which is estrogen and its connection to menopause. Okay, still on menopause, we have to discuss estrogen. So estrogen is a crucial hormone when it comes to women fertility, reproductive organs. All right, so its effect on menopause is what we're about to treat. So now, what is estrogen in general? Estrogen is a primary female sex hormone produced by the ovary or in the ovary to regulate various body functions, including reproductive cycle, the bone density, the breast tissue, the heart health, and the brain functions when it comes to women fertility and women's body and hormone production. All right, estrogen and menopause. What is the connection? During menopause, estrogen level significantly declines. It declines, and that is why most times in our profession, when you want to diagnose of menopause to know if a woman is actually giving signs or symptoms correlating with what she's giving us as symptoms, we first of all try to ascertain what the estrogen is giving us at that particular point. Go ahead and take the estradiol state, the hormone, the secretion at that point, know if it's declined or increased, so that we know how to help the person. So the connection between estrogen and menopause, already you've understood that once menopause is approaching, estrogen starts decreasing. It declines so well that is already a marker to show off a woman who is approaching, or already a woman that has menopause, has encroached menopause. All right, some signs of having those estrogen already in your system, the decline in your system, the challenges you face to show really that estrogen actually is connecting to that menopause that is approaching, or that menopause is what you're actually passing through. So what are those things? What are the things we are looking at? We are looking at the hot flashes that you're having. You know, all those hot flashes, sometimes you feel like you're having heat, or you're having high temperature, you're just unstable, you're not stable, you don't actually you can't actually explain how you're feeling, but you know inside of your system something is busy on there. Do you understand? But you cannot explain. Another one is the night sweat. You keep on having internal heat, you keep on sweating every night. Vaginal dryness is another symptom to show that this estrogen is declining in your system and menopause is encroaching. So mood changes all the time. It's somehow close to that of hot flash. Your mood is, you're always on mood swing, you're always unhappy, but you cannot actually explain what is wrong with you. Whenever you're with friends, sometimes people cheer you up, you cannot be able to like fit in or give it back to them, like smile the same way or joke alongside with them. You see that you're bitter, but you cannot explain why you're not happy. You keep on telling your friends, I think I'm not happy, and I cannot explain why I'm not happy. Another one is the sleep disturbance. You find out that as menopause is encroaching, that most times you cannot sleep well. Sometimes you come to the hospital, you keep telling us that you sleep like 2 hours, you wake up, you sleep 3 hours, you wake up, you can sleep for 6 hours, for the rest of the hours you cannot sleep again, depending on when you went to bed. Or you can go to bed and spend like 3 hours and you're not sleeping. So sleep disturbance is among the symptoms of high decline estrogen as well. All right, the weight gain. You find out that as menopause is encroaching, that you keep on increasing in weight. For some people, why some are just the way they are, rather the hot flash and the rest of it will keep on giving them those disturbance. The timing of bone is also a symptom, which is nothing else but osteoporosis. So another type of those things are the things we are facing as women when we are encroaching menopause, or when our estrogen is declined. So most times those things, deficiency in your estrogen is not really because your menopause is encroaching, but we are just discussing it generally as a symptom when it comes to trying to pin estrogen association with menopause. Sometimes you see a young girl, but the estrogen will be so low. Do you understand? There are other factors that can actually result to that because you are in your reproductive age and it's not meant to be like that. Still talking on the estrogen, there are different types of estrogen. There are 3 main types of estrogen: the estradiol, the estronic. I hope you're understanding what I'm saying. I talk about the estradiol. So as we're talking about the estradiol, what is estradiol? It's the most potent and prevalent form of estrogen during reproductive age. The estradiol is the primary form of estrogen after menopause. When a woman has already attained that age of menopause and has attained the state of menopause, estrogen is something you can actually pin. you can actually diagnose as a marker to show really this person has approached the age of menopause or attained menopause. Okay, another form of estrogen is estrol, which is so much small in its amount in our body, and normally it's during pregnancy is when you can actually identify, because it's so much important in pregnancy. Okay, as we continue, I hope we are digesting it, because we're trying to connect and treat and make you understand the effect of estrogen with your menstrual cycle. So in order for you to help yourself clear this surge or decrease the decline you are having in estrogen because menopause is approaching, there are several things you can actually do to help yourself. So we'll continue as we Alright, as we continue, there are other factors or certain things you needed to do in order to help alleviate the menopausal effect and help yourself, so that the hot flash and the rest of it will not be so much, okay? And the depression associated to it will actually be reduced. What are the things? The ones that you can actually get directly from your medical practitioner, do you understand? Includes the hormonal replacement therapy, the HRT. You must make sure you discuss this with your health professional. Make sure that once you're having this surge, once you're having those issues, do you understand? Try to get it digested. Try to understand. Don't keep anything left. Don't keep any symptom at home while coming. Make sure you discuss whatever issues you're having with your health professionals, so that the help you seek for will be achieved. All right. So as we're talking of the HRT, the hormonal replacement therapy, make sure you understand that this supplement given to your body to increase your estrogen and to alleviate menopausal symptoms, so that those forms of issues you're having will reduce. Another one is systematic pills, systematic HRT. Okay, all those things is what you can actually gain from your health professional. There are several things your health professional can help you do to regain yourself. And then, because we owe to ourselves to be in menopause stage at a particular age, you gradually get into it without having any issues, and don't have any issues when it comes to that. It's a normal thing that every woman owes. It will come. And as it's coming, you can stay free without having any issues. Normally understand that this estrogen decline in the system results to this, and menopause is approaching. So as we posted the menopausal what menopause is, I hope that this estrogen is equally digested with this association to menopause. Thank you as you keep on listening.